Greetings! The Chiropractic Educators Research Forum proudly presents this keynote session on the topic of burnout in education. To give us an introduction to this topic, we have presenting Charnay Naidoo, who is a full-time lecturer in the Department of Chiropractic at the University of Johannesburg. She has a keen interest in education research and is currently pursuing an additional doctoral degree. She teaches the chiropractic principles and practice and technique courses, and she provides research supervision of the Master of Health Science students. And she is actively involved in core activities of the chiropractic departments such as academic administration, course development, consulting, and community-related projects. Also presenting is Dr. Weston Halsinger, who is a chiropractic physician in the St. Louis area and assistant professor at Logan University. He is a Logan alum for his Doctor of Chiropractic, as well as a Master's in Nutrition and Human Performance. Dr. Halsinger completed a diplomat from the American Board of Chiropractic Internists and certifications in nutritional and functional medicine.
Burnout is a psychological condition that develops as a prolonged reaction to ongoing pressures at work. American psychologist Herbert Freudenberger coined the term burnout in the early 1970s. Burnout is characterized by declining emotional capacity, motivation, and commitment. Each person's stress can be experienced from a social perspective in how they view themselves and others. Some with burnout will have trouble sleeping, mental impairment, or discomfort. Others notice palpitations, stomach issues, or sound and light sensitivity. Persistent or distressing fatigue following mental and physical exertion is another symptom.
Burnout impacts the healthcare field and organizations. Physician burnout contributes to low patient satisfaction with poor communication and empathy. It also connects to poor care delivery and more reports of medical error. It's important to achieve a work-life balance to prevent burnout. Many occupations that work with people, including health services, education, and healthcare, have been shown to be at risk for burnout. Our working environments change, and this change makes it necessary to learn new skills, adapt to a new environment, and to strive for productivity. By building a supportive environment and attainable expectations, burnout can be prevented. Burnout is more common in young professionals. Young professionals are not experienced in controlling their work or work hours. High work demand has been identified as a contributor to burnout along with the work environment. By identifying burnout, organizations and individuals can better manage their workload. The work environment can help practitioners provide effective care to their patients.
Academics have many responsibilities, and some may face resource restrictions. Academics are challenged by increasing student numbers and students' need for academic support. Burnout in the education of healthcare professionals cannot be ignored. Fast-paced clinical training can have an influence on the rate of burnout before the student is qualified. This would again emphasize that the environment and workload should be balanced. This would allow for high performance and a good student experience during their studies. Online learning challenges may contribute to burnout among educators and students. Remote work has blurred boundaries between personal and professional lives. This has resulted in a greater chance of burnout. The management and prevention of burnout have increased as more people do identify and understand the topic.
For chiropractic educators, burnout has several negative consequences. Reduced enthusiasm, engagement, and ineffective teaching impacts the quality of education and the student's learning experience. Burnout can also lead to high turnover rates in faculty, disrupting stability and mentorship. Burnout amongst chiropractic students affects their academic and professional lives. Students may experience decreased academic performance. The outcome of this may compromise clinical competence, relationships, and the preparedness for future jobs. The increased physical work of spinal manipulation could add to the rate of burnout. The study of stress and burnout is critical for curriculum development. The curriculum can aim to reduce student burden and prevent burnout during practice. Burnout has led to poor patient outcomes in other healthcare professionals. The same could be said about chiropractic care. High burnout levels could result in poor clinical decisions and delivery of treatment. Effective communication is hindered, potentially leading to misunderstandings and mismanagement of patient care. Continuing education may suffer, as burnout can reduce engagement in professional development. These effects could have a long-term health consequence or harm the chiropractor's professional reputation. Thus, it is important for us to be aware of burnout and able to recognize it, both ourselves as faculty members and in our students. We should help our students to be aware of their own burnout and learn how to prevent it. This could assist them during their education and throughout their careers as chiropractors.